Well, we have several sympathetic and parasympathetic cardiac nerves, which regulate the conduction system of the heart. The sympathetic splanchnic cardiac nerves are the postganglionic branches of the superior, middle, and inferior cervical sympathetic ganglia. Respectively, we have three splanchnic cardiac nerves on each side: the superior, middle, and inferior one. The preganglionic sympathetic fibers come here from the intermediate lateral cell columns of the superior 5 or 6 thoracic segments of the spinal cord. Just to remind you, this column is located in the lateral horn of the spinal cord, and it is present only from T1 to L2 levels. The preganglionic parasympathetic cardiac nerves are the primary and secondary branches of the vagus nerve. The superior cervical cardiac branches arise from the main vagal trunks on both sides, while the inferior thoracic cardiac branches branch off from the main vagal trunk on the right and from the recurrent laryngeal nerve on the left side of the body. The preganglionic parasympathetic fibers synapse with the intrinsic intramural ganglia located in the atrial wall and interatrial septum near the SA and AV nodes and along the coronary arteries. The nuclei controlling the activity of the cardiovascular system are located in the medulla oblongata, in so-called cardiovascular center. You will have more details on this center and on the central regulation of the cardiovascular system in the brain and behavior module in semester 5. So, all these nerve fibers descend towards the arch of the aorta and the bifurcation of trachea. Here they make the cardiac plexus. The cardiac plexus is anatomically subdivided into a superficial and deep part. The superficial part lies under the arch of the aorta, just in front of the right pulmonary artery. And the deep part lies between the aortic arch and trachea, behind the aorta. The superficial part of the cardiac plexus is formed by the left superior splanchnic cardiac nerve and by both left parasympathetic cardiac branches. The deep part of the cardiac plexus is formed by the right superior, middle, and inferior splanchnic cardiac nerves, and by the left, middle, and inferior splanchnic cardiac nerves. All parasympathetic cardiac branches of the vagus and recurrent laryngeal nerve join this plexus. As you may notice, the only cardiac nerve which do not enter the deep part of the cardiac plexus is the left superior splanchnic cardiac nerve. All the other nerves, they participate in the formation of the deep part. So, what are the effects of activation of the sympathetic and parasympathetic system? You can see these effects in the table. The activation of the sympathetic input leads to the stimulation of the SA node, increase of the atrioventricular conduction, increase of the heart rate, increase of the atrial and ventricular contractility, and increase of the blood flow through the coronary vessels. While the parasympathetic stimulation leads to the opposite effects, such as slowing of the heart rate, reduction of the force of contraction, and constriction of the coronary arteries.